Hello everyone, it's been a while and I've had a few requests to give a little update on how I'm doing for my Inspire surgery. So right off the top, I can tell you that my device has not been activated yet. It has, let's see, my surgery was October 20th, so it's been a while. We've already gone through the end of January. I think today was February 1st, actually. So the reason why is, first of all, in my two previous videos, I talked about how I am very aware of how my body heals and that I fully expected it to take longer than your average person for my hypoglossal nerve to recover from the surgery. And that has in fact been the case. So you can still kind of see there's just a tiny bit of swelling right here. And I still have some numbness here in my neck. And my tongue is still just on all the way over on the right side of my tongue. It's still somewhat unresponsive because of the numbness and the healing right here. I have had 2 visits with my pulmonologist and with the Inspire reps, and we all agreed that it would be counterproductive to activate the device and start sending signals to this nerve when it's not fully healed. And so we have decided on a plan to just let my body heal, however long that's going to take. My doctor did do some research and found that, and when I say research, she looked into any other patients that may have been experiencing what I'm going through. And there were a couple other cases in our area of people that just took a long time, 6 months, 8 months to heal. I would like to point out that I am not the norm. I'm definitely the anomaly in this. And again, I was completely aware of the fact that it would probably take this long for me to heal. And so I've been okay with it. I am starting to feel some little tingles and some little pokes and pins every once, and that's good. I'm glad I'm feeling that. That means I'm feeling something. Every once in a while, I'll still get a little bit of a headache right back here. The ear pain has, wow. If we started 100% when I came out of surgery, the first week, I would say that I'm at like 1% now, if even that I'll feel that. And a lot of times it's just because if I've been talking a lot during the day, or if I'm eating something particularly chewy, like a steak or something, just by the end of the day, I'll start feeling it. But at this point, I'm encouraged by any kind of feeling that I have. You can tell that I'm talking pretty much normally. I don't have the lisp that I had with the first video that I did. And so my speech is practically back to normal. I'm chewing on both sides of my mouth fairly successfully. I still tend to favor the side of my mouth more, but definitely able to chew on both sides of my mouth. I'm eating pretty much whatever I want to eat. So that's not been an issue. There was somebody that asked if I regret getting the surgery, and I can say, nope, I do not, because one of the things that I talked about with my pulmonologist is the fact that I probably do need to continue using the CPAP, and still hate the CPAP, gotta say, not my favorite, but I'm very much looking forward to having this activated. Like I said, this is a long-term thing. I fully expected and have been emotionally and mentally committed to having this probably take about a year for me to heal and get activated and get my levels figured out and all of that. So I'm still completely happy with the surgery and glad that I did it. I'm glad that this option is available, and I'm very much looking forward to things improving. And they are. Progress is really slow. Nerves take a long time to heal, and nerves can hurt and kind of fire off and just be weird in some people. My husband did say that he works with somebody who had this done and had none of the, I guess, quote unquote complications that I'm dealing with. So definitely way out there on the bell curve. I'm on the very end of that bell curve of people who just take a long time to heal. So let's see. I'm trying to remember all the questions that were asked. Oh, in terms of visibility, I think you can see that the scar, I mean, this one is just completely diminished. And I'll just pull this down and show you down here. That one is healing nicely. One of the things I noticed about the unit is initially after the surgery, it felt like it was quite prominent in my chest and maybe even sort of protruding a little bit. But now it's like settled right back into my chest, and it's still a little tender just to poke it, so I don't poke it. So that'll continue to heal, and the tissue will grow around it. And from what I understand, it just gets to the point where you just don't really notice it anymore. In terms of my sleep, initially when I would try to sleep on my side, because I'm a side sleeper, it was sore or painful, and now way better. I'm able to sleep on my side a lot more. I generally will end up back on my back. I'm still sleeping a bit elevated. I'm not on the wedge pillow anymore. I'm on a couple of pillows, but really I just do that for the apnea sake, just so I'm sort of elevated, because I don't always like wearing the mask. And I think that's it. It's just a waiting game at this point. I do have some, I put a little salve on this and this for the scar, and I have a little, some essential oils that I'll put on this that help with nerves, and I think it's helping. I don't know. I'm gonna say it is. I'll just say it is. And other than that, if you have any other questions, throw them in the comments. But that's pretty much where I'm at. So when I get activated, I'll definitely do another video. But I hope anybody who is experiencing just that similar pain and perhaps issues with the nerves, that don't get discouraged, and know that your body will heal. It'll heal itself. I'm not really thinking about any kind of, oh, well, what if it never happens or whatever. I'm not going there. I'll think about that at the end of the year if we're still dealing with this and I'm not activated, and what those next steps are. But right now, I'm just letting my body heal and do what it needs to do, and trying to get quality sleep when I can. And I'm still glad I did it. I'm really glad I did it. So just healing up. What's that? October 20th, November 20th, December 20th. Yeah. So yeah, it's been 3 months or so, a little over 3 months. So that's where I'm at the 3-month mark. So maybe I'll do this again at the 6-month mark, and I'll have some better information for you. Let me know if you have any questions. Thanks.